Dear colleagues, I'm very happy to welcome today Professor Didier Pittet, who is a very well-known expert in the field of infectious diseases and in epidemiology at the University Hospital of Geneva. And thank you very much, Didier, to be here today with us and to discuss the opportunity of the vaccination against the flu. And my first question would be, is the flu finally a benign disease? Can it be dangerous for all of us?
Well, of course, it's not at all a malignant disease. It's most of the time a benign disease, and we can catch the flu. But as you know, if you catch a real flu, you can be very, very sick. You can be very sick for a week, even 10 days. You don't go to work, you have pain all over the body. So for yourself, it could be bad. Most of the time you're in good health, it won't. Now, if you are a person or an individual or a patient with some diseases, then it can kill you, unfortunately. And that's the problem. Every year in our intensive care unit, we have very young people dying from influenza. Not so many, and we have a series of old people coming with pneumonia, complicated, and dying of influenza, which is absolutely stupid when you imagine that we can be protected against this disease.
So should we get all vaccinated, everyone from general population, or only fragile people, or only healthcare people? Who?
What is the most important is to have fragile people, susceptible people to get the vaccine. I'm talking about people with cardiovascular disease, with pulmonary disease, with chronic disease, with cancer, and you know, your doctors know. They know who should be protected against influenza. And of course, healthcare workers, the people in charge of older people, should be vaccinated. So then we are moving into the population. If I am vaccinated, personally, it's for my patients. But it is also for my parents, because I don't want to give influenza to my parents when I go kiss them at Christmas or when I want to see them. So yes, ideally everybody should be vaccinated, but the one who should be vaccinated about all are the most fragile people and the people taking care of others.
And can we estimate the level of protection taken from the vaccination?
Well, the vaccine, you know, every year the influenza viruses are different. We cover between 50% and 85% of the transmission risk. So it varies from one year to another, of course. And it also varies according to the season, because if the season is very cold or not, depending where you are. So there are a lot of varieties. But clearly, if you get a population vaccinated, the virus spread not as fast and not as many people get the disease. So the benefit is very clear to get a proportion of the population that is vaccinated. And to almost stop the disease, ideally, you would need around 80% coverage so that it stops the spreads of influenza.
Within the past years, we faced the COVID epidemic, so the people interacted less each other, and there may be a risk of a much more important flu epidemics. Is that the case?
Absolutely. During the 3 years of COVID disease, as you know, we took all sorts of barriers like confinement, lockdowns, measures that prevent the spread of almost any disease, right? So influenza didn't spread. In autumn 2020, there was almost no influenza. In 2021, only a few cases. Now, which means that because of the spread not happening, the immunity of the population is not acquired the same way. So it means that this year, yes, influenza will spread. It will spread fast, and we'll have a lot of diseases. In addition, think about all these young children who never had contact with influenza. They never were prepared to get antibodies against influenza, and they are the major transmitter of influenza. So they will be sick, they will transmit the disease, and they will participate to the epidemic. So this year, the epidemic of influenza would be really impressive, it's for sure. We even have the evidence for that because, as you know, the influenza virus are spreading in the southern hemisphere before coming to the northern hemisphere. So during their winter in Australia, they had huge epidemics of influenza with people suffering, hospitalized, dying of influenza. So we know that this year influenza will be bad and we will have to protect ourselves against influenza, and within the protection, of course, vaccine is key.
So the global risk is more important. Are the expected symptoms from this flu virus this year, are these symptoms different or?
The symptoms won't be so different. Okay. As usual, you know what is influenza, it usually not change so much, but the number of people affected would be higher. And of course, because we haven't been in contact with influenza, we may have more symptoms than we used to be.
Is it too late to be vaccinated?
It's not. It's not too late to be vaccinated. It's not, because, I mean, we are entering into the flu season. The flu season can last between, 6 weeks and 2 months, even sometimes more. We have some cases of influenza in our hospital. We already had some young people in the ICU. So the influenza is here, but we are not in the major part of the epidemic. So I would encourage everyone to go get vaccinated as soon as possible to be ready to actually better fight against influenza.
So we understand very much the benefits of the vaccination. What about the risk? Are there precise risks from the scientific literature?
Well, there is always discussions and debate. There is no major secondary effect of flu vaccine. There are all sorts of discussions. We know about it. They are mostly sort of pushed by anti-vax people. The allergy story, I mean, if your doctors know you and know that you may be allergic to some component of this vaccine, he may just give you another vaccine. So we are back to medical practice. So honestly, this is really a disease that we can prevent, and the difference between the risk and the benefit is much, much higher for the benefits.
We are facing at least 2 epidemics, the one from the flu and the one from the COVID. Is it possible to get the 2 vaccinations at the same time, or if we have been vaccinated against COVID within the past few days or the past few weeks, is it possible to get the vaccination?
That's a really good question, and actually, yes, it's possible to get the 2 vaccines together. Remember that we have 2 different family of viruses. The family of the influenza viruses, the family of the coronaviruses, and of course the vaccines are specific against those families. So they are different vaccines. But in fact, you can get both vaccines together. That's what I did for myself to save time. Even some expert immunologists would tell you that it may be even a benefit because it may potentiate the effect of one to the other. That's an expert debate, and we won't have time to discuss it. But yes, you can get both together. Now, speaking of the influenza vaccine, you should go and get it now. Speaking of the COVID vaccine, of course, if you may have had COVID, natural disease, 2 weeks, 3 weeks, 1 month ago, in this case, wait for a little bit before your next dose of COVID vaccine. So again, look, discuss with your doctor and choose for the best choice. But I would say that, yes, we need to go for the influenza vaccine as soon as possible.
Thank you very much, Didier. It's very helpful to understand the benefits from this vaccination and to take a personal decision as a professional, healthcare professional, to be vaccinated against flu and also the COVID, the coronavirus. Thank you very much.
It's a great pleasure. It's clear, like as a healthcare worker, our vision and our mission is actually to get vaccinated. Of course, for us, it's a benefit, but for the benefit of the resident and the patients, we have the charge of. And for me, it's an ethical decision to go and get these vaccinations.
That's pretty clear. Thank you very much.
My pleasure.